Welcome back everyone, Dr. Naveen here from UPSC Medical. So we are back with final paper analysis of UPSC Medical Science Optional. So we'll be doing 2024 paper analysis in this video, and we have been doing previous year paper analysis from the year 2020, that is for the last 5 years. And the major reason behind putting up efforts to analyze the paper in detail is that it will form a very good base or pillar so that you can strategize your future preparation. Like if you're targeting for 25-26, most of your preparation should be strategized according to the pattern, the demand of the current exam, right? And that is the norm of UPSC, not only for optional, even GS. We focus a lot on previous years to understand what examiner is actually going to target in the next subsequent years. And I'm very happy that this year the 2024 batch was very happy with the content which is posted in the courses and the questions of the test series, which are almost replica of the final exam. And I have received so many happy messages saying that this time they were able to attempt questions well and they found paper very familiar, right? So in that sense I'm very happy, and from UPSC Medical point of view, I can proudly say that this time we hit 90% strike rate. And also we were focusing a lot on unasked version in the courses, right? So that helped students a lot so that they could actually work according to the demand of the exam, right? So that way, let's move on to the next part. So I'll start with a brief analysis wherein what exactly had happened and where were the repeats came from. So next I'll also give you the unasked topics list which has come up in this exam and how we were able to handle it. Then we get into the subject wise pattern analysis. Now wherever possible, what I'll try to do is, like for future prediction like 25-26, what could be the topic that can be asked, so based on this year's pattern. So I'll be also adding that, so make sure that you watch video till the end if you are a serious aspirant for 25-26. Now when it comes to brief analysis, so it goes without saying 100% of the topics are within the syllabus. There is some not some, it's again it's a gray zone in forensic medicine, right? In forensic medicine there is a topic called examination of, that is forensic examination of injuries. So they can ask any injury. So that's the reason they went into asking about brain death this time. Brain death is also an important topic for any NEET PG or next exam, right? This topic is very important from forensic medicine point of view. So they did ask about brain death. And one more development they asked, virtual autopsy, that is application of imaging, CT or MRI in forensic medicine. So it's a futuristic application. So I'll not call it as a out of syllabus, but again, as I said, forensic medicine, the forensic examination of injuries and wounds is always been a gray zone for the students. So apart from that, I could say it is 100% within the syllabus and almost 80% repeats. So I have been doing this repetitive, like I always say that this question, like medical science optional, if you just rely on the previous year repeats, you can attempt more than 80% of the questions. So in that sense, the whole courses of UPSC Medico are built on syllabus specific, previous year centric fashion. And we will be targeting a lot of unasked questions to cover a 20% of the non-repeats as a part of test series daily answer writing program, right? So that's what we are doing and it's working well. So it's always important that in the courses recently we have introduced PYP 5-year discussion. Okay, we are also providing previous year paper 5-year discussion plus model answers for that. And you could see, yes, it is proven again that there won't be many topics which gets repeated from the direct 2023 paper, but definitely as you move on, the representation increases, like almost 14 to 15 topics from each year starting from 2024 to 2019. So last 5 years is always important for medical science optional. Among that, if you are targeting 25-26, so it's important that you focus more on 23 paper rather than 2024 paper for the repeats. So there could be 15 topics which will be repeated from 2023 paper in your 2025 mains optional exam. Okay, got the point? So this is the first take home, that if you're targeting 2025, you should be perfect with papers starting from 2023 to 2020. But again, there are always surprises with UPSC. So in that sense, there is no harm in actually mastering 2024 paper 2, right? Yes. Now the best questions to choose, again I have given you the list. If you have attempted 2024 paper, just check these. So this best questions to choose, I give this based on what we have discussed in UPSC Medico, and also these questions contain lot of previous year topics. So in that way it is easy for you to attempt, and also these questions we have covered it in our test series. So if you're part of UPSC Medico, I think these are the best questions to choose to score high in this particular exam. So this time pharmacology was little offbeat in the sense we always prepare pharmacology as a first line drug. For example, let's take an anti-malarial. So when I say anti-malarial in India, the first thing that comes into my mind is chloroquine. Or in falciparum resistant species, we go for ACT therapy, that is artesunate combination therapy. And in the last 20 years, they have been asking alternate questions from chloroquine and ACT. So this year they asked a question on mefloquine, which is also important because we did discuss about mefloquine uses and why it is important, because it is a schizonticide. It helps in preventing relapse in Vivax. So what is the reason behind using mefloquine? So the next drug they are asking, that is what is mefloquine. So in that sense, also from antihypertensives, there was a question on natriuretic peptides and what is its use. Okay, so the one unasked topic which has come from pharmacology is natriuretic peptide. And your take home, the second take home from this particular discussion is that when you're reading pharmacology, so along with the first line drug, also read the immediate second line drug, because when you read ketoconazole, which was asked so many times in 2022, I guess they asked about fluconazole. Okay, but just for the fluconazole you can't go and read even the most latest classification of antifungal drugs, because that will put that is a time taking task, and pharmacology is hardly 35 to 40 marks wastage. So smart work is important, but that is your take home. The second line drugs are also important now. So the first unasked topic was natriuretic peptides, and there was cancer, effects of cancer related genes on cell growth. So I was expecting this, that's why in the test series we went into greater depth of neoplasia basics. So from Robin's path, if you open the topic neoplasia, there will be lot of basic questions, that is molecular genetics of cancer, carcinogenesis, the molecular genetics which are involved in carcinogenesis, right? And RB gene, P56. So these kind of things are important. So anything, so for future aspirants, the third take home is that focus on basics of neoplasia. So in the video course very soon I am going to deal neoplasia topic in greater detail. That is, we were focusing more on previous year topics so far, but with the analysis it is evident that the examiner is focusing in depth, in detail on topic neoplasia. Now next we have ALL. This is again, see, topic leukemia is there in the syllabus, and this leukemia is part of both pathology and also general medicine. So when we talk about leukemia, when you analyze previous year papers, the commonly repeated topic are AML, and among AML, the acute promyelocytic leukemia, that is M3, is more common. We call it as APL, or acute promyelocytic leukemia. So there were more questions on this topic, and CML was commonly asked. So it goes without saying, so next year we will be expecting, so because ALL has come, CLL could be a possibility from unasked version. So all four leukemias are now important, both from pathology point and also from general medicine point. That means you have to know about the clinical features, diagnosis, treatment also for these all leukemias, because it is integrated both in pathology and general medicine. And this is the strong reason in my courses I always stress upon the fact that integration is important for medical science optional, and you need to understand syllabus thoroughly. Okay, any UPSC aspirant, the fourth take home is understanding syllabus is key for success in UPSC. Now ALL is done. The next thing is, as I said, these two questions, though they are off the beat, because as I said, from gray zone point of view, one gray zone topic from forensic medicine is forensic examination of injuries. They can ask any injury, right? And next is Kwashiorkor and Marasmus. Luckily, this test series, it is a question from pediatrics topic. Okay, we know how important the grading of protein energy malnutrition is, right? As per the IMNCA and WHO and all. So in that, the two forms, the variant forms of protein energy malnutrition are Kwashiorkor and Marasmus. So the next thing is Kala Azar. Happy that this question got space or place in 2024 exam, because for last 2 years I am telling students that prepare Kala Azar, for reason being this Kala Azar is coming both in PSM, because India is trying to eliminate Kala Azar by 2024. It also comes in pharmacology. In pharmacology, anti-Kala Azar drug is part of the syllabus, and also this topic is there in general medicine, etiology, clinical features, diagnosis, management, and preventive measures of Kala Azar. So in that sense, this topic is very important, and they have asked a 20 marker question, and I have, wherever possible, I have included this Kala Azar question in the test series daily answer writing program, right? So it is very important, and they luckily this time we could see that the question has come from Kala Azar. Now, lichen reaction, for the last 5 years, starting from 2020, there is always a question on lichen planus. So in the lichen planus DD, we did discuss about lichenoid reaction, which is commonly by drugs. So many of the drugs, they produce lichenoid kind of reaction. So now, instead of asking lichen planus, because it's been asked for last 5 consecutive years, but still examiner thinks that this topic could be important. So what is your next take home? Whenever you read a topic which is frequently getting repeated, let me take an example of topic called placenta, or let me take a topic called embryology of heart. So if they start with embryology of heart, they started asking how interatrial septum develops, then they started asking how interventricular septum develops, then they started asking how right atrium develops, and this time they started asking how ventricles develop. So they will definitely repeat this topic, because this is very important. So that is PYT. But on top of that, what is the next possible question that can come? So the next possibility can only be predicted if you follow a predictive test series. That's what we are trying to do. So whenever we frame, every year we change questions as per the demand, and every year we try to predict. So in comparison, UPSC Medical test series is on a tougher level, for the reason being, I personally feel that you should be ready with all these predictive questions, right? And when it comes to placenta, again, every year they'll ask a question on placenta. One time they'll ask functions, other time developmental anomalies, or last time they asked structure of placental membrane. So same topic, a different touch to the question will be given. So in that sense, when you see this question, lichen reaction, it is DD part of lichen planus. Okay, differential diagnosis part of lichen planus. Next, I'm very happy again, because bone tumors, among orthopedics, when you take up the syllabus of ortho, there are 3 topics. One is Colles fracture. They asked it in 2023. So there is a topic of fracture spine, principles of management of fracture spine. So next year we might expect question on this, because this was asked around in 1998, I think. Okay, long back. And third topic is bone tumors. So they asked a question on pre-malignant conditions of bone and classification of bone. Luckily in test series we have a 5 marker question, classify bone tumors based on location, and it's very easy. What are the epiphyseal bones, what are the diaphyseal bones, what are the metaphyseal bones? And whenever you write questions on classification, make sure that you mention the basis of classification. There's one more topic, acute osteomyelitis, but this is actually part of pathology, not general medicine. General surgery includes ortho. There are 3 topics of ortho, and every year they started asking ortho questions in the last 2 to 3 years, and bone tumors was now part of the examiner's mindset. Now this 4th topic, this is coming from the pathology, acute osteomyelitis, pathogenesis, histopathology, and etiology of acute osteomyelitis. So the 4 topics, that's it. Orthopedics, nothing else. Yes. And next what we have is next topic is Hospital waste management. Again, an unasked version, but we covered hospital management for around 1.5 hours of video discussion, and it's been part of test series also. This topic plus there is one more topic called industrial waste. So in PSM the syllabus says management of hospital and industrial waste. So see, industrial waste per se, waste management is a social issue. So if you are preparing for UPSC, you will be dealing a lot about waste management and what are the policies India is taking and all. So industrial waste is out of our scope. Like for a medical doctor, you don't need to get into such a details, but for this exam point of view, just maybe in the future they might ask you classify industrial waste and what are the methods of disposal of industrial waste. Instead of discussing in the detail, I have posted information about this in article section of UPSC Medical website. Okay, after this class you can go and check there. Okay, article section, just to give you a brief idea about the future possibility of this question, that because both hospital waste and industrial waste management is part of PSM syllabus. Now management of labor is not completely unasked question. There are some topics, stages of labor and all. So we did cover a lot of management of labor questions in multiple areas of test series and daily answer writing program. And health information system, again from PSM, the static portion, they asked about pictograms this time. And this is one more important thing which I always discuss with the students, because in the syllabus leukorrhea was there and pelvic pain was there. These are the two topics. Examiner is not asking any questions for last 10 years, but this time suddenly, last year in 2023 there was a question on chronic pelvic pain. So this time we have anticipated either the question will come on acute pelvic pain or leukorrhea, because they haven't asked much questions on leukorrhea. And leukorrhea per se is non-pathogenic, but there are more questions on pathologic or pathogenic leukorrhea. In the pathogenic leukorrhea, in the past they asked a question on gonococcus, they asked questions on trichomonas vaginalis, they asked questions on candida or monilial vaginitis. So we were expecting questions on TB, that is, it could be most common cause of TB in India is pelvic inflammatory disease. Chronic PID is TB again, right? So pelvic inflammatory disease, an important topic or a long case. Okay, it's a long case for PG students. So PID, and one more topic we will be predicting for the future is, it is not actually an infection, but still we always learn this topic and very important for PG exams point of view, that is bacterial vaginosis. So PID, don't think that it is out of syllabus. PID is now asked as a part of topic called leukorrhea from the syllabus. Leukorrhea from the syllabus. And there are not major MCH programs which are asked in the exam except one. This is domiciliary midwifery service. Okay, so overall 75 to 80 marks were covered as part of course. Okay, so I could proudly say that we hit a 90% strike rate from the course, because we were anticipating a lot of questions from unasked version based on the previous year paper analysis. So the same thing will follow all the courses. We'll be adding up updated content so that you get exposed to all these things in the future developments or future updates of the UPSC Medical courses. So as I said, courses and all, many of the students were confused which courses are, what is the major difference between the courses offered by UPSC Medical. In general, if you open website of UPSC Medical, you see the first course, that is combo course. Combo is a combination of most of the resources which we actually provide. One thing is, we give you access to video course for 2 years. Why 2 years? Because this exam runs in a cycle of 2 years, right? Plus this also includes test series, and this time we have changed the pattern of test series with around 12 subject wise tests, around 4 sectional tests and 2 full length tests. The reason for putting up shorter tests is that to increase your rate of submission of tests, and we were able to be hit that point because students overall the percentage of paper submission has increased as we made subject wise tests more crisp and attemptable, right? So video course plus test series with 2 years access is combo course. But there will be some students, old students or students who are starting late, and students who have come across about UPSC Medico recently and they don't have enough time to go for longer courses. For them, we are either providing only test series for 1 year or video course which comes with notes you can access it for only 12 months, 6 months or 3 months based on your demand. Okay, you can even finish videos in 3 months because we offer around 220 hours of videos in the courses. Now it is up to you. If you're targeting 25, 26, you have to go for combo course for 2 years because it comes with everything with 2 years of access. As I told you, this exam runs in a cycle of 2 years. If you get only 1 year of access, maybe at the time of the exam the access to the content might expire. And also, as a medical science optional student, your preparation will not end after mains. So during mains to interview period, you have around 2 to 3 months of time wherein you have to revise medical science again, because 6 to 70 marks of the personality test, because you being a doctor, they will definitely drill you on health related aspects, right? So it is always wise to revise them. And when you join our courses, you don't have to worry about buying new edition of textbooks because our course is up to date. So whenever there is an update with regards to health data or health programs or any chronic disease management, like any change in algorithm of Harrison, Bailey and Love, Nelson, so any change, any treatment guidelines, any new drugs, etc., okay, so we will notify you. You will be receiving a new notes for that. So in that sense, you receive up to date content as per the demand of the exam. So you have combo course video courses which comes with plan A, B, C with 3 months, 6 months and 12 months access. Apart from that, we also conduct once in a while, mostly after the mains exam and also the post mains results, we will be planning batches of daily answer writing program. This is purely predictive. This gives you a quick let me compare test series versus DAWP, because a lot of times students get confused between these. Okay, how to actually make use of test series? If you are going for test series will have you extended 1 year access, whereas DAWP, it only comes with 2 months of access because we conduct 45-day program. So the test series access is flexible. That means in 1 year you can attempt tests as per your convenience. DAWP is mostly live. So on the day of the exam, okay, on day of the exam, you have to submit your paper within 24 hours of window period. So both comes with evaluation, both comes with video discussion, but this is recorded and this will be live video discussion. Okay, and when you have tests, you have subsets here. You can have subject wise tests of 100 marks, sectional tests of 50 marks, 100 marks again, and full length tests like our final exam. Okay, you will have paper 1, paper 2, so almost 500 marks each paper. Okay, so 250. So likewise you have 2 full length tests here. So this is a 45-day program. Daily one question will be given for 50 marks, and there will be live video discussion of the question, evaluation, top copies. So topper copies will be there for all the tests. We provide topper copies so that you get to see how a topper is approaching, so that you can work on presentation skills. So both are important, because when you are a part of combo course or a video course students, whenever you finish anatomy, immediate thing is go and finish off anatomy subject wise test, because in the subject wise test you get to see a lot of new pattern questions, and you will also be able to recollect what you have learned, and also you will be able to add lot of value additions there. Daily answer writing program happens post mains, so that you get a quick revision of all the topics plus quick answer writing practice. So just for the motivation and quicker revision, daily answer writing programs will definitely help you, and there are a lot of happy students who actually were able to improve their answer writing with the help of daily answer writing programs. Now this year we have introduced for 2024 revision classes, and this was an instant hit, because the biggest issue with medical science being a factual optional is students were finding it difficult to kind of revise it in 5-day time period, because 1 week end to other weekend you have exams. So first weekend you will be looking at general surgery exam for 3 days. So there is a gap of 6 to 7 days. There will be a language exam. So in the next weekend you have medical science optional. So these 5 days were always been horrific for the students because they can't open and read 12 subjects together, right? So we have conducted live revision classes, and we'll be doing that for 20-25 aspirants who actually clear their prelims, so that during their mains exam they get a fair and good shot at the revision in a predictive fashion. So these are the courses which we offer. So now quickly move on to the important discussion. Before that, there are some diagnostic dilemmas in the question in the exam paper. So how you should be able to diagnose a clinical question, then only you will be able to answer it. And what I noticed in this exam is diagnosis exams are not tricky, not that tricky. So difficulty level is, I could feel they are easy to diagnose. They are very easy in comparison to the previous year. And one major change was students always struggle to do differential diagnosis discussion in the exam. So when I do answer writing evaluation in the test series, a lot of students, they don't discuss differential diagnosis. But luckily this year there is no questions on discuss differential diagnosis, just what could be diagnosis for 2 marks. And this trend has been constantly there for last 2 to 3 years now. So first question, though there will be clinical questions in anatomy, physiology, biochemistry, that is static portion of the syllabus, the diagnosis will be given in the question itself, so you don't have to worry much. But this question, describe the components of nervous system which are concerned with conscious alert state, okay, that makes perception possible, okay. So they're indirectly they're asking what is the physiology of consciousness, okay, conscious alert state. And very importantly, the same thing, consciousness, that question has come in 2009. And physiology of sleep and consciousness is there in the syllabus. Every year they ask a question on sleep for the last 5-6 consecutive years. So this year they are asking the fellow question, that is what is consciousness. Next topic is, what are ribosomes? Ribozymes, usually enzymes or proteins. You won't see any enzyme of nucleic acid, but there is a ribosome, that is ribozyme, that is peptidyl transferase, which takes part in protein synthesis. So instead of asking the peptide bond synthesis in protein synthesis, they are asking you what is the role of ribosome in protein synthesis, peptidyl transferase. So there was one more question, 5D. A 50-year-old male presented with history of chest pain, polyuria, polydipsia. Investigations, HbA1c level is very high. Normally it is less than 6, right? 6.5 is ideal. So it is very high. That means this patient is a diabetic. Polyuria, polydipsia, elevated HbA1c with history of chest pain, but cardiac enzymes were normal. That means slowly this patient is developing some atherosclerosis, I guess, right? Some atherosclerosis, some microvascular and macrovascular complications. So diabetes with complication. But urine analysis showed proteinuria. So any proteinuria in urine analysis in a diabetic patient, you are suspecting diabetic nephropathy. Okay, so the most likely diagnosis here is the case of case of diabetes mellitus, probably type 2 because of the age, okay, with history of chest pain, could be a stable angina, because of coronary artery disease or atherosclerosis. Plus now, because there is proteinuria, likely diagnosis is diabetic nephropathy, because it's almost been 5 years, right? The patient is having this problem, diabetic nephropathy. So diabetic nephropathy has been asked last 2-3 consecutive years. So instead of straight away asking what is the microscopic findings and pathogenesis of diabetes mellitus, they are directly asking, indirectly they are giving you a clinical scenario, and so the diagnosis here is diabetic nephropathy. So one more question, a 55-year-old female presented with hematemesis. On physical examination, she has no fever, she is pale, no organomegaly, and hepatitis B is positive. See, chronic hepatitis B is leading cause of cirrhosis of liver, and cirrhosis of liver presents with a complication called portal hypertension, and this portal hypertension will cause esophageal varices, which leads to hematemesis. We all know this. So what is the most likely diagnosis is this. right? Cirrhosis of liver due to chronic hepatitis B leading to esophageal varices bleeding, probably because of complication portal hypertension. So describe the microscopic findings. So cirrhosis of liver is part of pathology syllabus. So cirrhosis of liver due to viral hepatitis with portal hypertension as a possible cause. So now write about cirrhosis of liver. What is its microscopy? And also, what is the pathogens of cirrhosis of liver? The same question, cirrhosis of liver, has been coming multiple times. So there is an indirect indication that whenever they ask pathology questions in the future, instead of directly asking, discuss the pathogenesis and histopathology of diabetic nephropathy, they'll give you a clinical question of diabetic nephropathy. But the soul, the concept, everything remains same. If you know diabetic nephropathy, you can answer it. But if you don't know how to diagnose it, then it becomes tricky. Right? So these are the two topics. Now, if you're just starting your preparation, you don't worry how will I be able to clinically correlate these kind of questions, because these kind of questions, they are integrated with medicine, because diabetes, complications of diabetes is part of medicine. And in our courses, when we discuss medicine, I'll definitely tell you how a clinical features of diabetic nephropathy and how a patient presents. Similarly, cirrhosis of liver is also part of medicine syllabus, so there I will teach you the clinical presentation. So you have to integrate it, you have to diagnose it, and you have to write answers here. So everything is within the syllabus. When you finish off the course, everything will make sense. So you can easily connect dots once your one-time preparation is over. Right? Now this question, as I said you, what is virtual autopsy? We all know about autopsy. Autopsy plus imaging, CT and MRI usage is virtual autopsy. This is again an integrated question, because applications of CT and MRI in forensic medicine could be a possible question in the future. Okay, applications of CT and MRI in forensic medicine, that is virtual autopsy. Medical imaging is there, right? In a similar way, forensic medicine imaging. Now diagnosis, next is what is the easiest method which can help in early detection of PEM. So these kind of easiest method which can help in early detection, so this statement or this line is neither there in OPGI, or neither there in Nelson Pediatrics, or neither many of my pediatrician friends, they are little bit confused, because usually here easiest method for early detection, that is they're asking about screening. So how do you do screening? Screening we do via anthropometric measurements. Anthropometric measurements, whenever a child comes to pediatric setups, we use growth charts for that. So any deviation in the growth chart indicates growth retardation, then you suspect protein malnutrition. So for easiest screening method for detection of growth deviation is growth chart. To be more precise, if I want to talk about protein allergy malnutrition, I have to actually look at multiple factors. Like I have to look at weight for height, I have to look at for edema, and very importantly, I have to look at for mid upper arm circumference. So for me, most easiest among these two is, because edema is clinical, weight for height requires growth charts, so that you have to know -3Z scores. So for that you have comparison chart. Easiest thing is to measure mid upper arm circumference by Shakir's tape method. Shakir's tape, right? We'll do detailed discussion of these kind of questions in the regular video course of that is, we have a PYP discussion section, right? So there very soon I will be uploading video discussion of all these questions in greater detail, and also predictive fashion, what could be predicted. So but for some questions students are having a diagnostic dilemma, so just highlighting that. So I would go for mid upper arm circumference by Shakir's tape method as the most easiest and earliest detection of protein energy malnutrition can be done by these methods. This is clinically. Even imagine investigations point of view, we usually measure serum albumin levels as an earliest screening method. Okay, that's it. Let's go to the next question. So next question in the diagnostic dilemma is, a 60-year-old male develops central chest pain while walking uphill. The pain is squeezing in character, radiating left arm, and relieving on taking rest. Exactly in 2023 they asked a question on unstable angina. So how to differentiate? See, there is a case of chest pain. The next thing is we ask is relieving factor, relieves on taking rest. But this chest pain could be, there are hundreds of causes, but chest pain plus squeezing in nature plus radiating to left arm, they all indicate squeezing in nature is Levine sign. So when central chest pain, squeezing in nature is Levine sign. So when all these features are present, I am looking at coronary artery disease, but coronary artery disease can be, if it is relieving on rest, then it is stable angina. If it is not relieving on rest, no, not relieving on rest, then I have multiple possibilities. It can be STEMI, ST segment elevation MI. It can be unstable angina. It can be non-ST segment elevation MI. So STEMI versus non-STEMI or unstable angina can be detected by ECG changes, whereas cardiac enzymes will be elevated here. So cardiac enzymes elevation is seen with non-STEMI. It is not seen with unstable angina. Okay, cardiac enzyme elevation is seen with non-STEMI, it's not seen with unstable angina. But instability is not relieving on taking rest. So if you know these things, you will come to know a diagnosis that it is stable angina. So you have to write for treatment of stable angina where there is no role for reperfusion, immediate reperfusion or thrombolysis. So if you are writing reperfusion and thrombolysis for this particular question, it will be simple mistake, not in detail, because you might be thinking about MI and you're writing everything. So don't do that mistake. Go for how you treat stable angina with glyceryl trinitrate. More focus should be on lifestyle modification. And if you have observed previous year paper analysis, you know how important it is to know the lifestyle measures for preventing cardiac diseases, and almost in 5 years there would be 4 repeats in the same topic. So it's both treatment plus preventive aspects in this particular question, right? Next, a young adult female develops asymptomatic depigmented chalky white macules and patches with no signs of inflammation over face and body orifices, that is hypopigmented patches. The commonest differential diagnosis is vitiligo. Next question, young female patient, acute inflammatory papules and vesicles all over her scalp. Vesicles is common, as I told you, with allergic contact dermatitis because of hair dye. So the diagnosis is allergic, not irritant. Allergic contact dermatitis, and gold standard for diagnosis is skin patch test. Now next, how will you manage 1 year 5-month-old child presenting with severe respiratory distress? 1 year 5-month-old, not newborn. Don't get confused. Some students, without even looking, they might see that it's a 1 day respiratory distress. They'll directly go to respiratory distress syndrome or hyaline membrane disease, and they'll write about Anderson Silver score, and they might write about the treatment part, that is surfactant deficiency, ensure approach for surfactant. So this is actually bronchopneumonia because there is history of fever and cough for 5 days. Right? Now, 50-year-old male, 3 centimeter nodule in the left lobe of thyroid with hard cervical lymphadenopathy. FNAC, orphan aneide nuclei, is classical of thyroid carcinoma, that is papillary carcinoma. And papillary carcinoma is a frequent repeat from general surgery for the last 3 years from the topic tumors of thyroid. Okay, that's it. So these are the only differential diagnosis questions. So if you have a myth that oh god, medical science is purely clinical, so we won't be able to diagnose them, it's just a myth, because it's simple, easy, and you hardly have 10 questions out of 100 questions which are clinical. Remaining all are factual, direct repeats. Okay, and the diagnosis itself is so simple and easy if you analyze previous year papers, if you have a good grip on syllabus, if you learn it in an integrated way. That's what we do in video course, because you will tend to know, if you know general medicine clinical features, you can apply this to paper 1 also. So in that sense, diagnosis becomes easy. Now we have done the major part of diagnosis discussion. We have finished about a little of what courses we offer and what unasked topics list have come, and lot of take home messages with regards to medical science optional. Now we'll get into the straight subject. What were the questions which were asked based on the wastage? We'll start with anatomy. So in the anatomy point of view, yes, brachial plexus have always been examiner favorite. You have to only learn 3 nerves, that is ulnar nerve, radial nerve, median nerve. And if you want to learn about the cord injuries, Erb's palsy, and Klumpke's palsy. Every year one or the other question will come. Last year ulnar nerve has been asked, so this year radial nerve. Next year you might expect median nerve. Okay, median nerve. So radial nerve, origin, course, branches, applied aspects. So radial nerve was already asked in 2014. Next, embryology of gut. Okay, embryology of heart is very important part. So what is the development of ventricles and phalanx, which is again integrated with pediatrics, one of the important cyanotic congenital heart disease. This time they didn't ask any question on that, so they have included in anatomy here. So any development of heart chamber, atrial septal defect, ventricular septal defect are very important with regards to embryology part of anatomy. Next is a middle-aged female lump in the midline of the neck, that is goiter. So thyroid swelling, it moves with swallowing and deglutition, right? Surgeon, yes. So diagnosis is already been given. You don't have to worry much in anatomy questions. So thyroid gland, they're asking you gross anatomy, relations, blood supply, lymphatic drainage, surgical anatomy. Okay, thyroid has been asked in 2002, 2013 and 2019 also, the same questions. Now uterus, it's a recent repeat in 2022. Same question has come. They have copy pasted it. Uterus, gross anatomy, ligaments. You know how important the supports of uterus to understand even prolapse of uterus, which is there in OBG syllabus, right? Blood supply, lymphatic drainage, and applied aspects have been asked. And uterus questions are coming from 2001 onwards, 2011, 2005, 2022. Now facial nerve, yes, one nerve if you want to pick in cranial nerves, it is facial nerve, and you're so lucky that they have asked the facial nerve, because in the video course I did discuss a lot of new nerves also and functional components of all nerves. I have recorded 1.5 hours of video just to give you an extra idea, because last year there was a surprise from cranial nerves. So because they went with basic nerve this time, they might surprise you with altogether a new cranial nerve or more in the lines of functional columns and components. So this functional columns and nuclei of origin is very important. And one clinical application, that is Bell's palsy. So 2014, 2010, 7, 19 and 22, there are a lot of questions on facial nerve. And as I always stress, applied anatomy of inguinal region is there in the syllabus, not whole, not gross anatomy. Applied, that means you need to know the differences between direct and inguinal hernia. And inguinal anatomy applied aspect has been asked from 1995, and you know how important it is. Our long case in medicine, right? MBBS, general surgery, inguinal hernia is a long case. So 1995, 2000, 2014, 2020, there were questions from this topic. That's it. Anatomy 70 marks. There's no surprises at all. Completely within the purview of the syllabus, because every year there was a surprise in question number 1 of 10 marks, which is actually costing us 10 marks in the final evaluation, which is not letting us to cross that 300 mark in the final exam. But this time we were lucky because all the questions are within the purview of the syllabus of this 70 marks. Next, when you look at biochemistry, biochemistry has weightage of 65 marks. Even biochemistry was predictive because iron absorption was asked last year itself. But this mucosal block theory was a little surprise for us, because we all know how iron gets absorbed. You have intestinal cell, you have DMT receptor, iron in the form of Fe+3 to Fe+2, it gets converted, it is transferred inside. From there again you have entry of iron outside. So you have hepcidin, which is acting here, hepcidin. And you have DMT receptor here acting here. This year 2 questions have come in iron absorption. One in mucosal block theory, other is what happens in anemia of chronic disease, that is anemia of liver disease and all. So hepcidin takes part here. So hepcidin physiology was asked as anemia of chronic disease for 5 marks. And mucosal block theory is nothing but whenever there is excess iron in the body, the mucosa itself will not absorb iron. So this is a physiological limitation. When we have excess iron in the body, our mucosa itself is saturated and it will not absorb iron inside. So this much is enough for mucosal block theory, but this much will not give you 5 marks. So in general, it is wise to mention the steps of iron absorption in general in your question. So iron absorption is examiner favorite nowadays, 2017, 18 and 22. I used to discuss iron absorption and iron metabolism as a part of physiology before, but this year I have changed it. Both for combo course students and video course students, there is an update that calcium metabolism and iron metabolism are actually minerals, right? So they are now included as a part of biochemistry, and it is changed in the course curriculum. They are now part of biochemistry. We have uploaded new detailed videos on this, okay, both calcium and iron metabolism, and they are now part of biochemistry. Because iron metabolism has link to physiology again, right? Because anemia that is hematopoiesis is there in physiology, so they might give you integrated questions in that segment. Now calcium and vitamin D, there won't be any exam without question on either vitamin D or calcium, and vitamin D is a frequent repeat. Calcium, role of vitamin D in calcium is also very important. Next question. So we did revise a lot of RDAs this year, right? So RDA is always there. Sources are very important. How vitamin B12 is absorbed, and what happens if there is vitamin B12 deficiency. Very common predictive question. If you want to choose two vitamins from B complex, go for folic acid and vitamin B12, which are frequent repeats. Which antibiotics and toxins inhibit protein synthesis? So inhibitors of protein synthesis is always examiner favorite question. Okay, 1997, 2018, 2022. They are asking inhibitors of protein synthesis from protein synthesis part of biochemistry. Now ribosomes, and explain briefly role. So what are the energetics of one peptide bond? So peptide bond synthesis, peptidyl transferase is a ribosome. Next, there are three things, that is renal function test, thyroid function test, and liver function test. So examiner is mostly asking liver function test, and once in a while, last year they asked thyroid. Renal function test was least asked. That's why in test series I have included the same question. What is the renal clearance, and what is an ideal method, that is inulin, for calculating renal clearance? Difference between serum creatinine versus blood urea. Why blood urea is not considered as a gold standard for this? So this we did discuss in greater detail, and video discussion is also available in the test series. So the same question has come. Either because they asked RFT this time, next time they might go for TFT or LFT. Okay. Now yes, this is also, we made a very good guess in the test series, because PCR was asked multiple times, and the last year there was question on RIA. So the repetition is reflip. So the cycle will repeat every year. Like how joints will repeat, shoulder joint, hip joint, knee joint, PCR, RIA, reflip, they'll repeat the cycle every year. Okay, these are all predictions. Okay, he might surprise you, so it is always advisable to learn everything, but when you're short of time for revision, you have to do it in a predictive fashion. And physiology for 65 marks, sequence of events at neuromuscular junction. We did practice image also of neuromuscular junction, and what happens in myasthenia gravis. Lot of times NMJ was repeat. Similarly, components of nervous systems. Yes, conscious state as told, 2009. Define consciousness. What are the areas of brain which are mainly responsible for it? Yes, cardiac output. We did discuss the factors which regulate stroke volume. Okay, stroke volume. So in the stroke volume versus how stroke volume is changed by end diastolic volume, that is preload effects on stroke volume. This is Frank Starling law. And cardiac output, in one way or the other way, they will always ask you multiple questions. So one of the important topic, and also regulation of BP. What is the role of baroreceptors and chemoreceptors in regulation of BP? That is short term regulation of BP they are asking now for 5 marks. Now yes, dwarfism. Last year I think they asked about acromegaly. Okay, acromegaly, that is growth hormone excess, acromegaly or gigantism. Now they are asking about growth hormone deficiency, that is dwarfism. Simple. Growth hormone is always examiner favorite, and manifestations of growth hormone excess or deficiency are very important. And yes, menstrual cycle, physiology, ovarian cycle and uterine cycle. Most of the times they ask uterine cycle. Now they are asking ovarian cycle, that is oogenesis part. Now, as I said, anemia of chronic disease. What is the role of hepcidin? If you know iron metabolism, you can even answer this. What is the physiological basis of anemia and chronic kidney? In anemia and kidney and liver disease means this is anemia of chronic disease. And yes, role of eosinophils in control of allergy reactions. Now, in every year they ask question either on RBC and sometimes on platelet. They never asked a question on function of WBC. But in the test series, we had a question. Name all the blood elements or blood cells, draw their images, and what is their function. So this question was asked in test series for 10 marks, and now you could see that there was a direct question. Describe the role of eosinophils in control. So you need to know what is the function of eosinophil. Here you have to draw the structure of eosinophil. That's what I told you in the image discussion, that we need to know the structure of all the blood cells. Okay. That's it from physiology. Quickly look into the pathology for 60 marks. Cancer, as I told you, neoplasia, the basics are very important. So what are the effects of cancer related genes on cell growth? Okay, apoptotic, pro-apoptotic, okay, genes, what are the genes, what are the tumor suppressor genes and all. So that part is very important. And previously they used to ask question on methods of lab diagnosis. So define cancer is a repeat again. Four most important investigations for lab diagnosis of cancer. Next, this question we did discuss in the diagnosis part. HbA1c level is high, cardiac enzymes were normal, urine analysis is proteinuria. So this is diabetic nephropathy. Similar questions in the past in 2020 and 2022. What is the pathogenesis? What are the diabetic nephropathy glomerular lesions? Now, microscopic features of breast carcinoma, very important. Now we have a 1 hour detailed video in the course on breast cancer pathology. Okay, so wherever possible, I also tried to cover the prognostic factors of breast cancer. Single most grave prognosis is lymph nodal involvement in case of this thing, but molecular wise, what pattern is more friendly, what pattern is more dangerous, we did discuss in detail in the course. And breast carcinoma, we know how important it is and how many times the question gets repeated in the exam. And this time we did cover a question on miliary TB and disseminated TB, the differences as a part of test series. But similarly, what are the differences between primary TB and secondary TB is asked. So TB is there in the paper. TB is always there in the paper. And this one, hepatitis B, hematemesis, that means chronic liver disease, probably because of cirrhosis of liver. So microscopic findings that can be expected here, and what is the pathogens of cirrhosis of liver in case of hepatitis B. Okay, so the cause specific way you have to approach it, right? Now, write in brief, yes, cirrhosis is always there. A lot of times they did ask questions on cirrhosis of liver. Now, describe the clinical features and microscopic findings in ALL. This was unasked question. We did discuss AML and CML in the course. So, in the future prospects of the course, ALL and CLL will also be added, and CLL will be expected question for the 2025. Pharmacology, weightage is less, but it is little bit surprising also, because we did discuss acyclovir as a part of antiviral discussion. We did discuss all the anti-cancer drugs, and a lot of students were asking, sir, there were no questions on anti-cancer drugs for the last 10 years except some cyclosporin and methotrexate. Do we need to learn everything? And suddenly the question has come. So luckily in the video course we did discuss all these two topics in greater detail, but per se these are unasked versions. Okay, new surprises. And as I said, chloroquine and ACT was done. Now this time they're asking questions on primaquine, why it is used for radical cure of malaria, because it's a blood schizontecide. It helps in radical cure of malaria. It acts on hypnozoids, sorry. It will prevent the relapse. Explain why albendazole is termed broad spectrum oral antihelminthic. Now, as I said, antiparasitic drugs was least asked. So that's why I did ask a question on classification of anti-amoebic drugs and what are the drugs which are used in ascariasis as a part of our pharmacology subject was test. So we were able to cover this question there, both albendazole and mebendazole, what is their use and what are the therapeutic uses. Albendazole is broad spectrum because it acts in lot of parasitic diseases. Okay. Now, role of diuretics, very important in management of hypertension. So there were questions on thiazide diuretics, furosemide, that is loop diuretics, and also spironolactone, and how they are used in hypertension is important here. Elaborate advantages and disadvantages. Straight question, the first question of our test series this year, pharmacology. Because examiner is bored of asking insulin, metformin and sulfonylureas. The next possible I predicted was SGLTs, because they are making a lot of sound in the clinical practice nowadays. So with that practice, I have put up the same question as a first question in the test series this year, and the question directly came SGLT2 inhibitors. Now, why infliximab? So we always learn about cyclosporin as an immunosuppressant. So this time they asked about infliximab. What is its therapeutic uses? So anti-cancer drugs and immunosuppressants are part of syllabus. We learn about sirolimus, we learn about cyclosporin, we learn about corticosteroids. The new drug which is added here is infliximab. Now, pharmacology of natriuretic peptides. We'll discuss anti-cancer drugs. Along with that, what is the new we will discuss anti-hypertensive drug therapy and what are the new drugs as a part of our course. Okay, new content will be added in the video course this time. Now next, let's go to microbiology, 50 marks question. So what is hypersensitivity? Enumerate different hypersensitivity reactions along with examples. type 1 hypersensitivity and what is its role in health and disease. Hypersensitive is a frequent repeat. So in immunology syllabus they only gave cellular and humoral mediated immunity, and every year they're asking question on immunoglobulins as a part of humoral mediated immunity. But we made a 2-hour immunology discussion wherein we covered, along with immunoglobulins, we covered all the cell mediated adaptive immunity, natural immunity, passive immunity. We also cover hypersensitivity in greater detail, all the hypersensitivity reactions and their mechanism, and we also covered autoimmunity, immunological tolerance. So we went to such an extent that the whole immunology is covered, anticipating that examiner will definitely ask one or the other questions, and suddenly you see for a 10 marker you see hypersensitivity. Last time they asked type 4 hypersensitivity, this time they're asking type 1 hypersensitivity reaction. Now what is candidiasis? Different presentations and etiological causes. So see, from microbiology the syllabus includes diseases caused by and lab diagnosis of. So what are the presentations and etiological causes? You need to know what are the species of candida, what kind of diseases they cause, and what is the laboratory diagnosis. So whenever it comes to candida, it is very important to write about beta-lactam assay, right? The invasive candidiasis. We did discuss a lot about what are the features which decide invasiveness of a candida in multiple ways in the video course and the test series discussion, in the DAWP discussion also. You know the importance of invasive candidiasis. It's a frequent repeat. And what is shigellosis? Yes, Shigella bacillary dysentery, and the species, the 4 species of Shigella, what is the pathogenesis of Shigella, and what is the laboratory diagnosis. Okay, important. Now, multiple times the questions have come from this topic. I'm not putting up, I have given you the years just to indicate that you have to, your learning should always be in a PYQ centric fashion rather than A to Z fashion. Okay, enteric fever, typhoid fever, always important. What are the species of typhoid? That is salmonella typhi and paratyphi A and B. Detailed presentation of case according to the time of the disease and respective tests used for diagnosis. Okay, how a case present, the clinical features. Why they're asking clinical features? Because typhoid fever is also been a part of general medicine also. Okay, they'll not ask you the detailed clinical presentation in all the diseases. It is integrated with infectious diseases. That is, whenever I discuss infectious diseases plus microbiology, I always put up this thing, and students are confused. They only read microbiology and they attempt a test and they fail to write about the infectious diseases part, that is general medicine component of microbiology. And it is high time again, as per the analysis of the questions, I could say that they are integrating questions a lot. Now pathogens of enteric fever is like the enteric fever itself is a important topic. There is multiple years this question got repeated, right? And draw a diagram of HIV virion. See, we are so lucky that I was stressing, even for 2024 going batch I have shared almost 150 plus images for practice, and we did discuss in the revision batch also all the structures of each virion and how to draw it. And the question has come this time. Draw a diagram of HIV virion depicting the various antigens and proteins. Okay, very important. P24, GP180, GP120, where they are present and all. So practice, you have around 11 to 13 microorganisms. You need to know the structure of all these microorganisms, mainly viruses. When you go to parasites, you need to know the life cycles. Here you need to know about the viruses. And give the serological pattern in HIV infection according to the time of presentation, and various diseases associated with AIDS. Opportunistic infections of AIDS always been an examiner favorite question, OPSIS. Okay, so this time only for 2 marks, but very important. Next you have questions on forensic medicine for 50 marks. One is injury. Okay, if you're writing injury, also mention BNS sections as we discussed, because last year they asked as per the IPC. If you mention BNS, the examiner will be very happy. And what are the methods to determine the age of an injury? Death due to hanging. Hanging was always an important question, and I was able to cover the same question in test series this time, because hanging and drowning, this part there are least repeats of the questions. Okay, so last year they asked a tricky question from hanging. During hanging and strangulation there will be hyoid bone injuries. So suddenly there was a question, draw a labeled diagram of hyoid bone and what are the various fractures of the hyoid bone. But this time straight question, what is death due to hanging, what are the causes of death in hanging, and what are the findings you see in case of judicial hanging for 5 marks. Luckily, we covered this question in the test series this time. Discuss how excess dose of paracetamol toxicity, repeat poison. So one more gray zone in forensic medicine is toxicology. They can ask any toxin, and there are around 13 toxins plus one snake poisoning which was repeated. This time I was expecting scorpion poisoning or arsenic poisoning or mercury poisoning or strychnine poisoning, which are not asked. But instead of asking a new toxin, they did ask us a repeat toxin, which we are already know. You all know importance of N-acetylcysteine, which is used for paracetamol poisoning. Okay, very important concept. And a rare question, maybe you need to have an application knowledge of forensic medicine. Virtual adoption. See, always FMT been a surprise for us. Last year they went into asking forensic ballistics in detail. I don't know who is setting up the paper. The examiner is a core forensic specialist, right? A lot of application based questions. So that's why this year in revision classes also I went into a lot of application based approach to forensic medicine. Okay, if you have attended revision classes, you know the importance of that. Now define brain death, and head injury is always there in the syllabus. In 2018 they asked a question on head injury, coup and counter coup. This time they're asking what is brain death. So we're done with paper 1 part of analysis, and most of the questions are repeats from previous year topics, and there are some outliers and unasked version which we were able to predict as part of our courses. Now let's get into the general medicine, that is paper 2 section A, high weightage 80 marks. And yes, usual pattern. The first mandatory part, the question number 1 will be from medical imaging 1A, and 1 will be from psychiatry. Okay, just to let you know that these are also important as a part of general medicine, and these are mandatory every year. 20 questions. Like last time they asked a question on clinical features for schizophrenia. Now they're asking clinical features of depression. Next time they might ask clinical features of anxiety, because only 3 psychiatric diseases are there in the syllabus: anxiety, depression, schizophrenia. So they'll repeat the cycle again. Before that, they used to ask pharmacological and non-pharmacological management of depression. Then they ask pharmacological, non-pharmacological management of anxiety. Then they might ask schizophrenia. I was expecting schizophrenia questions treatment this time, but suddenly they asked a question on clinical features part. So next time they'll ask clinical features of anxiety again. Now, role of chest X-ray in pulmonary TB. Last year they asked a question on role of X-ray in acute abdomen. So whenever you see any X-ray and ultrasound, you need and a disease, you don't have to prepare separately from them. You know how important chest X-ray is, and you all know what is Simon's focus, Rich focus, Ghon's foci, Ghon's complex, how a patient chest X-ray helps him in diagnosis, how a cavity looks. You have to draw the images, whether it is an upper lobe or lower lobe, which lobe is involved, any associated complications with TB like TB pulmonary effusion, how it is seen. So these kind of things you can discuss here under the role of chest X-ray in diagnosis of pulmonary TB and ruling out other differential diagnosis. Okay, little bit of miliary TB, how it looks also can be given here. Yeah, depression, clinical features. When you're writing clinical features of any psychiatric disease, mention the DSM-5 or ICD-11 criteria, whatever is problem, diagnostic criteria, symptoms. Now discuss in short about different modalities used in diagnosis of extrapulmonary TB. See, now pulmonary TB, chest X-ray. Extrapulmonary TB, there are multiple things. The whole TB diagnosis itself I did discuss in detail in the video course, like what is IGRAS, okay, interferon gamma releasing assays, and what is Montauk's test, how it is helpful in diagnosis of latent TB, and different modalities for extrapulmonary TB. So what are the different organs involved? If you take TB meningitis, how will you diagnose? You go for CSF analysis, you go for AFB culture. Along with that, we also go for CT and MRI, and what findings you can expect there. Okay, that could be a possibility. So you have to write tests in general, and also tests apart from pulmonary TB, which is diagnosed by chest X-ray. What are the other tests which can be done for extrapulmonary TB? Now, yes, small absorption syndrome. In 2017 they asked a question. It is less frequently repeated topic. So because they're asking clinical features of malabsorption syndrome in general, maybe in future they will be focusing on malabsorption in general rather than asking a specific management of idiopathic tropical malabsorption. Before that there was questions on celiac disease, which can be a potential question in the future. Okay, malabsorption syndromes. Kalas are, I said, very important clinical features, diagnosis and treatment. And yes, management of stable angina here. Management of stable angina. 60-year-old female, central chest pain, squeezing in character, radiating left arm, relieving on rest. That is stable angina and how it is managed. Very important topic. Right? Next. Now dermatology, you have 50 marks again. Very important. Scabies, they asked a question. So the topic is scabies. They asked a question. It's a repeat. Vitiligo, they asked a question. There's nothing new or a surprise in dermatology. You have 6 diseases, out of which 4 diseases will come in exam, and one disease is our superstar, that is lichen planus. Every they're asking questions. Then 1 year if they ask psoriasis, next year they'll ask scabies. Okay, then they'll choose from remaining. And one more star is dermatitis. Always dermatitis or eczema and lichen planus are our superstars. Psoriasis or scabies, they're asking one question, and then instead of asking vitiligo, they'll ask Steven Johnson syndrome next year. So these are only the 6 topics you have in the syllabus. Okay, now you have scabies, vitiligo, dermatitis, that is allergic contact dermatitis, in this case hair dye allergy, and you have lichen planus. That's it. These are the questions they'll ask. Pediatrics also, they'll repeat a lot of questions in pediatrics. In pediatrics, because you have 7 topics, protein energy malnutrition is our superstar always, and they'll ask questions on respiratory distress. They'll ask questions on cyanotic congenital heart disease. They used to ask questions of IM&CI basics, and we stressed a lot on IM&CI basics this year, but they haven't asked any specific IM&CI question. Instead of asking IM&CI question, they went into asking question now on bronchopneumonia, and also baby friendly hospital initiative or breastfeeding is being an examiner favorite topic, and also immunization part. That's it. These are the topics they'll ask questions on. So you could see protein energy malnutrition, Kwashiorkor marasmus, and how will you treat. You have phases: stabilization phase and initial phases of stabilization. Okay, initiation phase and stabilization phase is first phase. Next comes rehabilitation phase. During stabilization phase, you have early feeding with F75 and F100 diet. So diet related question is there in the syllabus this time. And easiest method for detection of PEM, as I said, could be MUAC, Shackey-Stop method. Okay, Shackey-Stop method. And 10 steps of baby friendly hospital initiative. The same question I asked in the test series, important. Advantages of breastfeeding, we have asked this question in daily answer writing program. Very important. Anything related to breastfeeding, breast milk versus human milk, advantages of breastfeeding, how breastfeeding is given, steps of breastfeeding, steps of latching, okay, steps of proper attachment, signs of proper attachment, sore nipple, that is issues with breast. Anything related to breastfeeding is high yield for our exam. High yield for exam. If you come across something about breast milk, read about it. That's why even Mother's Effective MA program is also been included in PSM for discussion. Maybe in the future they might ask you. There is an article of MA program even in the UPSC MEDICO website. As I said, immunization important with pneumococcal. So predicting that pneumococcal might come in the daily answer writing program, we did ask about pneumococcal vaccine. Previously they asked about same question on Haemophilus influenza vaccine. Okay, pneumococcal vaccine is used to reduce the incidence of ARI. This was asked in 2017. Pneumococcal vaccine is sometimes capsular polysaccharide vaccine. It was asked in 2022. But now they're specifically asking what is the type of vaccine, what is its national immunization schedule. Okay, yes, and what are the infections it safeguards against. Next, respiratory distress, very important, but it's very important how would you differentiate between respiratory distress of respiratory origin and that of cardiac origin based on the DD. And cyanotic heart disease, they did ask about complications of cyanotic heart disease, and they asked about questions on pneumonia. So mix and match questions. One, you need to know the different causes. Other, they're asking about one cardiac cause and one respiratory cause. Right? That's it. Now, general surgery for 70 marks. Okay, enlist the conditions having, this is tricky because bone tumor is unasked version so far. Students were unable to understand this question clear. That is, enlist conditions having increased risk of malignant disease in newborn. That means they're asking you what are the predisposing, like oral cancer, how they ask, what is the predisposing causes of bone tumors? What are the predisposing causes? One cause I know is chronic osteomyelitis for sure. Other thing I know is Paget's disease of the bone, which can be a other thing I don't know is fibrous dysplasia. These are all predisposing causes. There are n number of causes. These are the few important things that I know. Otherwise, giant cell tumor is a malignant benign tumor which can turn into malignant. It acts like a malignant. So you need to know the pre-malignant conditions of the bone and cartilage. Chondroblastoma can turn into chondrosarcoma. Osteoblastoma can turn into osteosarcoma. Okay, so these kind of things they are expecting. And classification of bone tumors, I would prefer you to write about classification of bone tumors based on location you can do, or based on, you can say primary or secondary you can write, based on benign versus malignant you can write. Whatever you want to choose you can choose. But whenever you write answers for classification of bone tumors, make sure to mention basis of classification. Okay, that's it. A 55-year-old male underwent subtotal gastrectomy, CS stomach. See, among 13 cancers we read, I have predicted that 3 cancers might come: CA stomach, CA larynx, and CA prostate. Luckily, we got 2 cancers, CA prostate and CA stomach. CA larynx could be next year because this is unasked. They haven't asked any question on carcinoma larynx so far. Maybe they are thinking that it is ENT related, but that is there in the syllabus of general surgery. Next, write the clinical features and diagnostic workup in a case of CA rectum. It was a repeat, Duke staging, and surgical options. We did discuss this in greater detail in video course. Now, again, this is papillary carcinoma of thyroid based on orphan Annie-eyed nuclei. They're asking you diagnosis, how it is managed, prognosis, and post-operative complications. We all know after removing thyroid, we have hypocalcemia, which can present with obstetrician's hand sign, Trousseau sign, okay, Chopstick sign, etc. Right, hypocalcemia, because parathyroid glands will be resected. And also one more thing is hoarseness of the voice because of the damage to RLN now. Very important. These two, if you write, you will get very good marks in this particular question, because the weightage is 7 marks here, post-operative complications. It's a repeat again, papillary carcinoma, 2 times they asked in the last few years. And causes of hematuria and management of CA prostate, important, a repeat. OBG, again, there were questions on fibroid uterus. We have predicted it because prolapse was asked last year. This time we are guessing on fibroid uterus. And AUB, I was always telling you the change in terminology part of AUB to DUP in the regular cases. There are a lot of things that changed. Okay, you have you don't have acute renal failure. You have acute kidney injury. You don't have millennium development goals. You have sustainable development goals. These are the terms which should be changed, but they haven't updated syllabus of medical science from 2009 onwards, or 2011, I guess. So this is the change. We don't have chronic renal failure. Now we have chronic kidney disease. We don't have primary biliary cirrhosis. We only have primary sclerosing cholangitis. We do have DUB, but now we have a broader terminology called AUB. And I did stress upon the fact that AUB, now we have POPQ classification, very important. And the same question has come. Recent classification of AUB is not POPQ, palm coin classification. Okay, palm coin classification, it's part of our notes. Okay, and endometrial patterns in various types of AUB is a little tricky, because we only discuss endometrial pattern of metropathia hemorrhagica, which has cystic glandular cheese pattern. So cystic glandular pattern, if you can just draw that also, it's fine. You will definitely get 2.5 to 3 out of 5. Now, young married, contraception of choice, various methods of contraception, easy question, repeat question. Various methods of female sterilization and what complications can be expected in tubectomy, easy again. 22-year-old, 38-week gestation, labor pains. Coming to evaluation. So what will you do when she presents for labor, and what is the management of labor? Here you need to discuss the importance of partogram and stages of labor, and how will you manage each stage of labor, stage 1, stage 2, stage 3 and stage 4. And also unbooked, that means no prior investigations are done. So during obstetric triaging, we go for blood grouping, typing, etc. We'll check for the lie of the baby. We'll do an immediate Leica to check for like then fetal heart rate pattern monitoring will be done. So everything. So when labor starts, what you do is obstetric triage, and how each stage is managed, and special focus should be on active management of third stage of labor, right? That's it. And yes, from complications of third stage of labor, one commonly asked question was PPH. The other complications are uterine rupture. The other complication could be uterine inversion, which could be a future question, uterine inversion. The other complications are shock. It can be because of air embolism or amniotic fluid embolism. Or other complication can be retained placenta. It can be because of placenta accreta or adherent placenta syndrome. So these are the third stage complications. They did ask last year question on retained placenta and PPH. So this year they're asking a question on ruptured uterus. Next year question might come from uterine inversion or obstetric shock, maybe because of amniotic fluid embolism. So these are the two predictive questions for next year. So what are the signs and symptoms of PID? So this is again part of hashtag leukorrhea topic of the syllabus. Okay, PID, complications of PID, and unilateral tuber ovarian abscess, how it is managed. Antenatal care, what are its objectives? Schedule of antenatal clinic visits. Now there is a change, right? WHO now recommends 8 visits instead of thing, but in India we still have 4 visits, and it is important MCQ and PG based exams. And what are the advantages and disadvantages of domiciliary midwifery service? And finally we have PSM. PSM, we have predicted lot of national health programs, developments and all, but instead of asking many, they stick themselves to a basic question from NACO, National Arts Organ, NACO, National AIDS Control Program, okay, NACP. And new questions from unasked version, hospital waste management, yellow category, and what is incineration, clearly discussed in our video course. And this is also HIV AIDS 1995 categorization was discussed. TB HIV coordination, I already told you, like very important. Nowadays patients living with HIV, they have probability of developing TB, and in PG entrances they ask a common question, that is iris syndrome, what is it and why it is developing in TB HIV patients. And sources of health information, limitation of hospital records, and this pictograms is a little bit tricky and new question. We'll discuss this in detail in our regular video course, previous year paper discussion of 2024. Now yes, epidemiological studies, different types, and control sources of case control, advantages, case control versus cohort table I have given you in the notes. If you just write that, you'll get good marks here. Right, so this will conclude our discussion, detailed discussion. Soon I'll be uploading 2024 paper video discussion in all the video courses, plan A, B, C, and also the combo course part. And I have already given you enough details about the different courses we have. If you need further guidance on this, you can get back to me. We do have a DAWP program which is coming up real soon, and revision courses will be working to fine tune them and to make sure that we conduct each year post GS classes. For those 5 days we'll be doing live revision classes for the students. Okay, so if you have any further queries on this, do contact me on this number. I am Dr. Naveen, academic director and the mentor from UPSC Medico, and I am here to guide you for UPSC Medical Science Optional. I am doing this job for almost 5 to 6 years now, and we have 1000+ students or aspirants who are now part of UPSC Medico, who are learning for Medical Science Optional. So our motto or aim is to make sure that you master your optional, and when you start your UPSC preparation, the optional headache should be gone and you should be focusing more on general studies, which is a new domain or new arena for any medical student, right? So if you have any doubt or question, get back to me. I am here to mentor you. And if you have any doubt related to the question which is there in the 2024 paper, you can use the comment section to type in your doubt. I'll get back to you through the YouTube comment section also, right? So all the best.